A2E assessment. Hi everyone. I am Nurse Swot, the owner of the channel. Today we will be looking at an approach for the A2E assessment. Let's begin. Demonstration for airway assessment. You need to assess the airway. Tell me, what would you do here?
Observe and instruct.
Yes. You are correct. What should you observe?
Is this person responding verbally to the questions being asked? Do I hear noisy breathing? Is this person gagging, turning blue and struggling to breathe?
Perfect answer. Those are indeed some of the signs to observe when assessing the airway. Now, what can you instruct the person to do to assess the airway?
I can instruct the person to open the mouth and cough. If this is done, it confirms that the airway is clear.
Great. Now, what would you tell the examiner?
The airway is clear, no visual obstructions.
Demonstration for breathing. You are now required to assess breathing. What would you do first?
I would assess the respiratory rate.
How would you assess the respiratory rate?
I would instruct the patient to place one of the arms across the chest, with fingers pointing upwards to the shoulder. I would also verbalize that I will be counting the pulse rate for 2 minutes.
Lovely. That's right. Count the pulse rate for 1 minute and the respiratory rate for a next 1 minute. The patient should not be made aware of you counting the respiratory rate prior to starting. So I know why you would state you will be counting the pulse rate for 2 minutes. What else would you do?
After counting the pulse rate for 1 minute, I would keep my hand in the same position. I would then count the respiratory rate for a next 1 minute by watching the elbow rise and fall as the patient breathes.
There is an important aspect that you left out. What do you think it is?
Let me think. Oh yes. I remember. After the completion of counting both vital signs, pulse rate and respiration rate, I should state the reason as to why this was done to the person being assessed. Exactly. Can you give me an example as to how you would state this? Sure, Nurse Swot. This is how I would say it. Miss Lily, even though I said earlier that I was going to do your pulse rate for 2 minutes, it was in fact 1 minute to assess your pulse rate and a next 1 minute to assess the respiratory rate. Hence 2 minutes. I did not made you aware of this, as awareness alters the breathing rate, and this would have affect the reading.
Lovely. Always remember the NMC Code of Ethics. Be open and candid with all service users about all aspects of care and treatment. What other assessment for breathing are you expected to carry out?
Assess the air entry.
Can you explain how would you do this?
Sure, Nurse Swot. I would place the palms of my hands at the end of the sternum, xiphoid process, with thumbs touching in the midline of the person's chest. Then I would ask for him or her to inhale and exhale to measure chest expansion. 2 to 5 inches of chest expansion should be observed.
Correct. That is one of other methods that can be used to assess air entry. Now, you are also required to assess the oxygen saturation and observe for signs of respiratory distress. How would you do this?
To assess the patient's oxygen saturation, I would inspect the nails of the hands, then assess capillary refill prior to placement of pulse oximeter on the index finger. To assess for signs of respiratory distress, it entails visual and noises. I would observe the patient's breathing and note for the use of accessory muscles, sweating, cyanosis, and seesaw breathing. I would then listen for any abnormal breath sounds such as rattle, stridor, wheezing, or coughing.
Lovely. Now, what would be your final response?
Respiratory rate was 16 breaths per minute. Rhythm regular, depth good. Oxygen saturation was 100% on room air. No respiratory noises heard such as rattle, wheeze, stridor or coughing. No visual signs of respiratory distress, such as use of accessory muscles, sweating, cyanosis, or seesaw breathing. There is equal air entry.
Demonstration for circulation. When assessing circulation, remember pulse rate and capillary refill fall within this category. As said previously, the pulse and respiratory rate should be assessed within a 2-minute time frame. Remember it is 1 minute each. The capillary refill was also assessed prior to placement of the pulse oximeter. This was also discussed previously. Remember, you do have a choice to group or to not group these assessment. As long as you manage your time wisely and complete each required task to secure your marks. Now, how would you assess the blood pressure?
Prior to assessing the blood pressure, I should briefly explain what the procedure will involve. Let the patient know that if at any point the cuff becomes unbearable on the arm, he or she should let me know. I am then required to gain consent to proceed with the blood pressure measurement. But first, check if the patient has a preference as to which arm to use. And query if any surgery was done on the arms, or if arms sustained any injury. Position the patient sitting on a chair, with their arm comfortably placed at approximately heart level, legs uncrossed and feet flat on the ground. Notify the patient that once the blood pressure machine starts, he or she will feel a slight pressure on the arm due to the cuff inflating. And that there is nothing to worry about. After doing all of these, I will start the automatic blood pressure machine to get readings. Then quickly make jottings of the readings, and move on to the next assessment for circulation.
Lovely. Always query if any surgery was done on the arms or if arms sustained any injury. And remember to notify the patient that once the blood pressure machine starts, he or she will feel a slight pressure on the arm due to the cuff inflating. There are 2 more assessments that you are required to do to complete the circulation assessment criteria. Pallor and perfusion. How would you do this?
To assess pallor, I would inspect the skin, lips, conjunctivae, nail beds, palms and/or soles of the patient. I would also instruct him or her to extend the arms. Then I would use my hands to touch both arms bilaterally, in a downward motion, to feel the warmth of his or her skin. The same approach would be used to assess the legs. I would instruct him or her to extend the legs, and once more, I would use my hands to touch both legs bilaterally, in a downward motion, to feel the warmth of his or her skin. To conclude this section, I would say, pulse rate was done earlier, it was 94 beats per minute and within range. Rhythm regular. Blood pressure was 102/66 millimeters of mercury. Capillary refill was prompt, less than 2 seconds. No pallor observed. Perfusion is good.
Demonstration for disability. You are required to assess the conscious level of the patient using the ACVPU assessment tool. The acronym means alert, confusion, voice, pain, and unresponsive. This assessment method requires you to determine the following. Is the patient fully awake and at their level of cognition? If yes, he or she is alert. Is the patient oriented to person, place, and time? If not, is this person confused? And if he or she is confused, you are expected to acknowledge the deficit and reorientate him or her. Voice. Is the patient responding when you talk to them using words? If not, are they grunting? Pain. Is the patient responding to a painful stimulus, such as supraorbital pressure? Sternal rub? Is this person unresponsive? Not responding in any way during the assessment. You are then expected to conclude your findings. The next assessment task you are expected to carry out is for pain. How would you do this?
I would use the nursing mnemonic, PQRST, as a guide to assess pain. For the provoking factors, I would ask, what makes the pain better or worse? For quality or characteristic, I would ask, what exactly does the pain feel like? Is it sharp, throbbing, dull, or stabbing? For the region or location, I would ask for him or her to show me where the pain is. Is it the head, chest, abdomen, etc.? In addition to, I would query the severity of the pain, using the pain scale of 0 to 10, 0 being no pain, and 10 being worst possible pain. I would ask him or her to rate the pain from 0 to 10. And finally, for temporal, which speaks to the onset, duration, and frequency of the pain, I would ask, does the pain come and go? How long does the pain last? And when does it start? After which, once more I would conclude my findings.
Lovely response. Remember, the 0 to 10 numerical pain rating scale should be used during pain assessment, and the scores are interpreted as follows. 0, relaxed and comfortable, no pain. 1 to 3, mild discomfort. 4 to 6, moderate pain. 7 to 9, severe or intense pain. And 10, extreme or worst pain possible. There are 2 more things you are expected to assess for the disability criteria, do you remember?
Yes. I am expected to assess the urine output and blood glucose level.
You're correct. You are expected to query the last urine output by asking the patient, when was the last urine output? Please bear these in mind as you will need to determine if the patient has normal urine output. 1. Urine should be passed at least every 6 hours. The normal urine output volume for 24-hour is 800 to 2000 milliliters per day, with a normal fluid intake of 2 liters per day. Meaning if a person intake 2 liters of water daily, they are expected to have a urine volume of 800 to 2000 milliliters per day. These are terms you are expected to be familiar with. Oliguria, the reduction in urine output less than 500 milliliters per day or less than 0.5 milliliter per kg per hour. Polyuria, this is frequent passage of large volumes of urine more than 3 liters or greater than 200 milliliter per hour. And anuria, this is the absence of urine, less than 100 milliliter over 24 hours.
Thank you, Nurse Swot, for this revision. I truly appreciate it. I know the assessment task for blood glucose. I should ask when was the last blood glucose done and what was the last reading. If the patient is unable to answer, I should ask my examiner.
Yes. The examiner will state if the reading was normal or abnormal, or a reading will be given. Please keep in mind that for persons who are diabetic, before having a meal, he or she should have a reading within the range of 4.0 to 7 millimoles per liter. After meals, a reading less than 9 millimoles per liter is expected for people with type 1 diabetes, and a reading less than 8.5 millimoles per liter for people with type 2 diabetes. For persons who are non-diabetics, before having a meal, a reading within the range of 4.0 to 5.9 millimoles per liter is expected. And after meals, a reading less than 7.8 millimoles per liter is expected. Remember to keep these readings in mind for your clinical practice. Now, how would you conclude your findings for the disability criteria?
Patient was conscious and alert, responding to questions asked. Oriented to person, place and time. No reports of pain. Last pass urine 2 hours ago, 1000 milliliter. Last blood glucose check was done prior to breakfast and was 7 millimoles per liter.
Demonstration for exposure. The final assessment is exposure, E. What are you expected to do for this area?
Assess the patient temperature using the thermometer. Inspect the skin for bleeds, rashes or bruises. Ask if he or she is experiencing any bleeding. And query if the patient has or had any injuries. I would also obtain the patient medical history by reading the past medical history for the patient using the overview of recent history form that was given to me, then query if anything else should be added.
Well done. Now how would you conclude this assessment?
The temperature was done earlier, it was 36.2 degrees Celsius and within the normal range. No bleeds, rashes, bruises or injuries. Then I would read the past medical history for the patient using the overview of recent history. Example: Mr. X, I see here on this document that you have a past medical history of hypertension since the year 2000, hypothyroidism since 2006, and type 2 diabetes since the year 2000. Is there anything else to be added?
Perfect. We have now completed the A2E assessment. Just some quick tips. For the OSCE exams, the assessment station duration is 20 minutes. You are expected to fulfill the required tasks on the marking criteria within this time frame. Find an approach that allows you to manage your time. For the A2E assessment, ensure you do not skip any required task on the marking criteria. Know what to say after completing an assessment to secure your mark. Remember to perform hand hygiene as required. Once more, time management is key. Thank you for watching this video. Remember to leave a thumbs up on this video and subscribe to channel for post notifications.